have some sort of connection to the drug epidemic. Be it prescription opiates, heroin, or meth, many of us have a family member, a friend, a coworker, an acquaintance, or just know of someone who uses those drugs. And it's not easy to talk about. Just saying injecting heroin can be jarring to hear someone say. But what happens when we don't talk about these things? Well, people suffer and people die, including people we love. So when we begin talking about these things, we can start talking about what we can do. And one of the things we can do, one of the things we know works, are needle exchange programs. What are needle exchange programs? I remember a time when I was asked that question. I was in a writing class here at UNC-Asheville almost exactly a year ago, and I was working with a writing partner to workshop our essays, and my essay was related to the heroin epidemic, and the topic of needle exchange programs came up. It can be uncomfortable talking about these things, issues of drug use, but I was still able to give a response. I was like, a needle exchange program is a public health program where people who use drugs can access clean needles. I was a little wobbly, but I was able to give a one-sentence definition. The problem with talking about these things, these issues, is that they're so complex that a one-sentence definition won't cut it. I want to think of today as a redo of that conversation. Because it is up to us to challenge that uncomfortableness I felt in that moment and talk about these things, these issues, and their solutions for the sake of a better world for people who use drugs and for the people in their lives, because this epidemic touches everybody's lives. During that same conversation, my writing partner told me that they had recently transferred from another university in North Carolina. And making conversation with them, I asked them about their time at that university. And pretty quickly, they told me about the drug use at that college. They told me that there was an ambulance outside the dorm rooms pretty regularly because of an opiate overdose. We are living in a very bad time for people who use drugs. People all around us are dying, overdosing and dying in hospitals, in homes, in streets, in dorms. If we want to live in a world where paramedics aren't rushing into dorm rooms to save a student unable to breathe on the floor of their room because of an overdose, we collectively have to do something. Now, to understand needle exchange programs, you can't just go off that one-sentence definition I gave that writing partner. You have to understand the approach or the model that goes behind needle exchange. And this approach is called harm reduction. Harm reduction aims to reduce the negative health consequences associated with drug use, be they the consequences of injecting, contracting communicable diseases, potentially overdosing, or overcoming the isolation and judgment people who use drugs feel. It is non-judgmental and provides a safe space for people. It's built on the respect for and the acceptance of people who use drugs. Because harm reduction understands that for a lot of people, drug use is very complex, and harm reduction neither ignores nor condemns drug use. Now, harm reduction can be hard to visualize, so I think an example would help. So let's make up somebody. This is, let's say, Andy. Andy is 25 years old. He has a girlfriend. He works at a restaurant. He has 2 dogs. He's just a regular old guy. Andy also, for the last year and a half or so, has been using heroin, and he worries about things like getting HIV or hepatitis C or potentially overdosing, and he wants to do something about it. Now, Andy's tried going cold turkey or completely stop using altogether, but that hasn't worked for him, and that can be dangerous for some people. And Andy's heard about a needle exchange program in his area, and he's decided he wants to visit one. So he goes in, and he's greeted by someone who works there, and they'll walk him through what they have to offer him, mainly giving him clean needles. Some people right off the bat think, wait a minute, what are clean needles going to do if Andy is still using drugs, he's still injecting? And that's a fair question. Injecting is the most common way hepatitis C is transmitted, and injecting increases your risk of getting HIV. So outbreaks in cities are common because of this, because people share needles. And across the country, needle exchange programs have been an effective way to reduce HIV and hepatitis C rates. For a lot of people, maybe like Andy, maybe not like Andy, if they don't have clean needles with them, they may choose to share those used needles. So needle exchange programs give out clean needles to combat this reality. Yes, if Andy could completely stop injecting altogether, that would protect him from getting HIV and hepatitis C from injection. But that's not where Andy's at in his life. He may not have stopped using, but now with clean needles on hand, he can protect himself, others, and his girlfriend from getting those diseases. That's what this harm reduction approach is all about. Andy's working incrementally towards better health. And harm reduction understands that for a lot of people who wish to stop using drugs, abstinence at the snap of the fingers usually isn't possible. To Andy's surprise, needle exchange programs do more than just give out clean needles. They educate him about how to inject safely. They tell him about how he can protect himself from an overdose. While Andy's there, they also give out something called Narcan, which is a medication that can reverse an opiate overdose. They'll not only give it to him, but they'll also show him how to use it and to tell him that he should have it on him all the time. Again, some people say, what is Narcan going to do if Andy is still using drugs? He's still injecting. And the thing is that heroin death rates have jumped over 500% since 2002, and today, every day, people are dying. 130 people are dying from opiates. So a lot of people are dying. And the fact is that Narcan saves lives, and it saves many. One needle exchange program here in Asheville received over 280 overdose reversal reports in 2018 alone. A reversal means a saved life. And sure, you can get Narcan from a pharmacy, but not everybody can afford Narcan, and not everybody feels comfortable walking into a pharmacy and buying it because of the stigma people feel. At a needle exchange program, it's free to get, and it's safe and accessible, and there's no stigma attached to it. Again, to Andy's surprise, needle exchange programs offer more things for him. For example, the needle exchange he's at, they give out something called fentanyl test strips, which are test strips that identify a drug known as fentanyl that is commonly put in drugs like meth or heroin. And fentanyl increases your risk of overdosing and dying. And that's one of the reasons why there are so many overdoses. Because for a lot of people who are getting their drugs, they don't know for sure what they're getting. Is Andy about to inject heroin, or is there actually a bunch of fentanyl put into it, making him at greater risk of overdosing and dying? He doesn't know for sure. So again, while he's there, he's given the test strips, but he's also shown how to use them. So when he does leave and he does inject, he can test to see if there's fentanyl in it. But again, needle exchange programs don't stop there. They offer resources, information, referrals to substance use treatment, detox centers, and HIV and Hep C testing. So needle exchange is focusing on Andy's health, reducing harm for him. And if Andy comes in and says, I want to go into treatment, needle exchange programs are there with the next steps for him. Not only does Andy receive all this information, but needle exchange programs actually benefit from the information Andy provides them. So this is what it would actually look like. He would sit down, he'd be asked a couple of different questions. Questions such as, do you need Narcan? Have you done any reversals since you've last been here? Any opioid reversals? Do you need fentanyl test strips? The last time you used the test strips, did it come back positive or negative for fentanyl? These questions are so important because they help needle exchange programs identify problems in the community. Needle exchange can monitor overdose trends and spikes in fentanyl circulation. So needle exchange is helping Andy, and Andy is helping the needle exchange better understand the problems in his community. When Andy leaves, he also feels more supported and connected because of the needle exchange. He has a voice, and his decisions are respected. Because above all, needle exchange programs create a sense of community for people who use drugs. Now, I've covered needle exchange programs, I've covered harm reduction. That explanation to that writing partner still isn't complete. So I have to talk about some of the myths associated with drug use and harm reduction. The first myth, the main myth, is that needle exchange programs encourage drug use. I mean, come on, we're giving we're giving people needles that must be enabling. I mean, responsible drug use, that can't be a thing. And that's not true. Needle exchange programs don't encourage people to do drugs, they encourage people to do drugs safely. And needle exchange programs, they don't enable people. And responsible drug use, that's certainly a thing. I mean, Andy is displaying responsible drug use. There's no evidence that suggests needle exchange programs enable people to do drugs more. The only evidence there is that needle exchange programs protect people from getting HIV, protect people from getting hepatitis C, protect people from getting infections, protect people from dying. Needle exchange programs only do good things. The second myth is that needle exchange programs mean more needles littered in streets and parks and neighborhoods. And first of all, needle exchange programs actively encourage people to bring in used needles. While Andy's at the needle exchange, they'll give him something called a biohazard container or a sharps container where he can store his used needles. And he can bring them back and they'll be disposed of properly. And actually, after the first needle exchange program, a lot of times established in a city, needle litter actually decreases. In Portland, for example, where I used to live, after the first needle exchange program was opened, needle litter decreased by almost 2/3. And needle litter isn't a consequence of needle exchange programs. Communities simply need safe and accessible ways to dispose of used needles. But communities just don't always offer that. The third myth is that needle exchange programs cost a ton of money. I mean, they sound great, they must be expensive. And first of all, protecting people from getting communicable diseases and giving the health care they deserve and protecting them from dying, there's no price you can put on that. But actually, needle exchange programs are not extremely expensive. They're actually considered cost-effective because they prevent HIV and hepatitis C cases. So what that means is if Andy protects himself from getting HIV from injection, that will mean thousands of dollars saved in treatment costs. And these things are great. The fact that needle exchange programs are cost-effective and they clean up streets. But I would argue that on top of those things, the fact that needle exchange programs create a sense of community and connection for people who use drugs, that those things are just as important as all those other services. I work at a needle exchange, and I meet many different people, and I get to know them. I mentioned community a little bit before, but I really want to emphasize that needle exchange programs do, in fact, create a sense of community and connection and inclusivity for people who use drugs. But that connection and community is only within the four walls of needle exchange. If I were to see Andy out in the street or in a store, it wouldn't be right for me to say hi, because it's still not safe to acknowledge that connection. But it should be. Human connection and community. Those are the things that needle exchange programs create, and that means all of us.